If you're watching this video, chances are you're feeling overwhelmed. Your elderly father recently survived a stroke. He's finally home. And you thought things would get easier. But now you face a new struggle. He refuses to sit up to eat or to take his medications on time. You may find yourself asking, what do I do if he simply won't cooperate? How do I keep him safe and nourished without a fight every day? You're not alone. In this video, we'll talk about why stroke recovery often leads to these challenges, what strategies can help, when to call the doctor, and how you can care for your loved one without burning out. Let's walk through this together, step by step. Understanding why this happens after a stroke. First, let's talk about the why. Strokes damage parts of the brain that control not only movement but also motivation, judgment, and awareness. Here are some common reasons stroke survivors refuse to sit up or take medication. Physical weakness and fatigue. The body is simply exhausted. Even sitting up can feel like running a marathon. Cognitive changes. Some people experience apathy, meaning they just don't feel motivated to do anything, even things they logically know are important. Depression. After a stroke, it's common to feel hopeless or sad. This depression can look like refusal or stubbornness. Fear or anxiety. Your father may be afraid of choking or falling, especially if he has swallowing problems or balance issues. Loss of appetite. Strokes can disrupt the senses of taste and smell, making food unappealing. Swallowing difficulties. Dysphagia. Up to 65% of stroke survivors have trouble swallowing safely. If eating feels scary, they may avoid it altogether. When you understand what's driving this behavior, it's easier to respond with empathy, not frustration. Immediate first steps to keep him safe. Before you address motivation, make sure there isn't a medical emergency behind his refusal. Ask yourself, is he more drowsy than usual? Has he stopped speaking, or is he slurring words more? Is there any sudden weakness or new numbness? Is he unable to swallow fluids at all? If you notice sudden changes like these, call emergency services immediately. If it's more of a gradual decline or ongoing issue, these steps can help. Check positioning. Is he lying flat most of the day? This can cause low blood pressure and make him feel dizzy when he tries to sit. Offer fluids and light snacks. Dehydration and low blood sugar can sap energy and make sitting up feel impossible. Monitor medications. Some drugs, especially sedatives or blood pressure pills, can cause extreme fatigue. If you're unsure, call his doctor or home health nurse for advice. How to help him sit up safely. Sitting up is critical for preventing pneumonia, pressure sores, and choking. Here's how to help your father sit safely without making him feel overwhelmed. Step 1. Prepare the environment. Clear clutter around the bed or chair. Adjust lighting so he feels secure. Warm the room if he tends to feel cold. Step 2. Explain what you're doing. Speak calmly and clearly. Dad, let's sit up so you can have a drink. I'll help you. Step 3. Move slowly. If he's in bed, raise the head of the bed gradually. Support his shoulders as you help him pivot. Let him rest in stages so he doesn't feel dizzy. Step 4. Use pillows and supports. Prop pillows behind his back and under his arms to reduce strain. Step 5. Check for discomfort. Make sure he's not in pain. Sometimes refusal is about discomfort he can't easily explain. If he still resists, it may help to reframe the moment. We don't have to eat a full meal right now. Let's just have a few sips of water. Small steps can feel less intimidating. Encouraging eating when appetite is low. Loss of appetite is common after a stroke, but good nutrition is essential for healing. Try these strategies to make meals more appealing. Create a routine. Serve meals at the same times every day. Familiar schedules build trust and comfort. Offer smaller, frequent meals. 3 large meals can be overwhelming. Try 6 smaller snacks. Enhance flavor. If taste is dulled, use herbs, spices, or a splash of lemon to brighten flavors. Limit distractions. Turn off the TV and background noise so he can focus on eating. Sit together. Many seniors eat better when they have company. Share a meal, even a small one, so he doesn't feel alone. Use adaptive utensils. Special cups and plates with grips can make eating feel less stressful. Check swallowing. If he coughs or gags, ask his doctor for a swallow assessment. He may need modified textures or thickened liquids. Strategies for medication refusal. Medication keeps recovery on track. Here's how to handle resistance. Stay calm. Avoid arguing or scolding. It can increase anxiety and refusal. Give one at a time. A handful of pills looks overwhelming. Offer them one by one with sips in between. Use liquid forms. Ask the pharmacist if medications come in liquids or dissolvable tablets. Explain simply. Instead of saying, "You must take these," try, "This pill helps your heart stay strong." Timing matters. If mornings are worst, consider adjusting the schedule so he takes medications when he's more alert. Track and document. Keep a log of doses, times, and any refusals. This helps the medical team adjust plans. Talking to the doctor about ongoing challenges. If your father's refusal lasts more than a few days, it's time to call the doctor. Be ready to share when the behavior started, how often he refuses to sit up or eat, any new symptoms like fever, confusion, pain. Medication list. Recent vital signs if you track them: temperature, pulse, blood pressure. Sometimes underlying causes like infections, depression, or medication side effects are at play and they're treatable. Managing your own stress and expectations. Caring for someone after a stroke is one of the most challenging things you'll ever do. You may feel frustrated, sad, or even angry, and that's normal. Remember, you can't control every moment. Progress may be slow and uneven. Small victories matter. Give yourself permission to take breaks. Ask for help. Join a caregiver support group. You deserve support just as much as your loved one does. Encouragement and hope. It can feel like your father is slipping away, especially when he won't engage. But often, these moments of withdrawal are temporary. With time, therapy, and gentle persistence, many stroke survivors regain strength, appetite, and independence. Be patient with him and with yourself. Even on the hardest days, you are making a profound difference in his life. If this video gave you clarity or comfort, subscribe for more guides on stroke recovery, caregiving, and senior health. And if you know someone caring for a loved one after a stroke, share this video. It could be the support they need to keep going. Stay strong. Stay informed. And remember, you are not alone on this journey.